One of my greatest joys was dancing. Ballet taught me respect for your body, respect for health, respect for life. Growing up, I was a very active child, never sick, never took medicines, cough syrups, never needed them. Until one day, I woke up, my hands were hurting me and couldn't figure out why. And that's where my journey started. Within that first week, I knew something was wrong with me. I ended up going to see an endocrinologist. She said, "There's nothing there." And I said, "I know myself. I'm not a person to get sick." I then went to see a rheumatologist. She saw some swelling and she said, "I can give you some cortisone." And I said, "No, thank you." So all I had was just excruciating pain, which radiated into my neck. And then I started with cognitive issues. Not being able to read, not being able to concentrate, certainly not being able to drive. We went everywhere to find something. Change your diet, take this cream, try this therapy. Nothing was helping. But it wasn't until destruction started in my hands that somebody finally said, "I think it's rheumatoid arthritis." They tested, it wasn't that. Again, I had the feeling that they really didn't believe that there was something wrong. They started me on injections and it started to alleviate a lot of the pain and it cleared up the cognitive issues. After 6 weeks, nothing. And the next shot came and it did about half of what I was used to. I waited, I did it the next week, even less. I went through all of the drugs. Then my children started noticing Mom was a lot quieter.
She started to get a little bit more like loopy at the beginning, like she would just get agitated easier.
She would start asking like people to open bottles and what does this say, and started needing like heavier prescriptions in her glasses to read.
It was different, like having my mom be someone who was very fragile, like you couldn't go and properly hug her because her joint hurts.
And then at some point she just completely stopped reading to me.
When you went to touch her hand and you saw that all of her fingers are bending.
And then the rashes started. It all added up. It looks like lupus.
I didn't really understand what was going on and that kind of stressed me out. So I looked online and I tried to see what rheumatoid arthritis was.
And he was telling me, "But Mom, you can't eat cheese anymore because it makes the pain in your joints worse. And Mommy, you can't go in the sun because with lupus, if you go in the sun, you have this problem and that problem." And that just kept rolling like this until I was put in touch with Dr. Jane Salmon at Hospital for Special Surgery.
When Beth Ann came to me, she was frustrated, she was in pain, she had pretty dramatic deformities in her hands and had been on, she said, every medicine there is for rheumatoid arthritis and nothing works. What's wrong with me? My research interest is very focused on pregnancy and women with lupus. Women with lupus have pregnancy complications. She had late losses. That's very, very rare. It's really common to have a miscarriage at 6 weeks. To have something like that at 16 weeks speaks to some fundamental problem, and she had 3 of those. After reviewing her lab test, examining her, and thinking hard about her history, it was clear that she had lupus that was masquerading, in a sense, as rheumatoid arthritis. And I actually thought about the immunology of lupus and the overlap between that and rheumatoid arthritis to select something that could hit both elements of disease.
The infusion therapy unit at the Hospital for Special Surgery is very typical of infusion units in the type of drugs that we give. The way we're atypical is in the population of the patients who receive the drug. We're almost 90 to 100% dealing with patients with autoimmune disease.
And after about 3 months, I started to notice an incredible change in my situation.
When you walk into HSS, and you say you have lupus, there are 10 or 15 people who understand the cells that are causing your disease, the inflammatory mediators that make you hurt, the latest drugs that can prevent or block these pathways, and then to have the psychiatrists and the social workers. That's really how we treat our patients in a multidisciplinary, very complete, holistic way.
It's okay when you can't think straight and you can't concentrate. That's why I would like to help in getting my story out there, to give somebody else the inspiration that they need to get through something.
Her ability to be comfortable talking to me about whatever changes gives her confidence and courage.
The rheumatology department was my savior. That is what helped me and led me back to a life that now I can live.
Well, now she's pretty much upbeat a lot, and she'll do a lot more things.
Didn't you try to water ski last summer? Yeah, she water skied last summer.
My daughter turned into such a wonderful young lady because of ballet. And with my illness going into remission, that's something that's been given back to us.
We empower our patients because they teach us. They teach us how to do what we do even better.